Sarah Atherton.
Thank you, Mr Deputy Speaker. Firstly, I would like to relay messages of thanks to the Treasury from a plethora of businesses in my constituency of Wrexham. Without the government's generous package of support, we would now be facing business closures and job losses. I would also like to put on record how the people of Wrexham have stepped up to support each other during this crisis. Small cottage industries, community interest groups and neighbour groups have sprung into action to check on the vulnerable people, keep morale high, deliver food, parcels and prescriptions. Wrexham, you have answered the call, and I am proud to serve you. Now, Wrexham sits on the border with England, and life for us involves weaving between England and Wales, and we look to the UK government for advice during this national crisis. However, here in Wales, under a devolved Welsh Labour government, we have seen disjointed plans and delays in delivery of shielding letters, the 111 service, shopping delivery slots, confusion over public health data collection, and latterly the abolition of targets in which successes or failures can be measured against. Testing and analysis has been chaotic, which has been of particular impact on our care homes. The organisation of volunteering on a national level was also slow to get off the mark, with Welsh Government taking weeks to decide to delegate the coordination of volunteering to statutory agencies or charities. As a former nurse, I joined the Covid-19 temporary register to support NHS Wales nurses on the front line. After 2 months of waiting, I have now started back to the floor, and I've been overwhelmed by the resilience and spirit and determination of the hospital staff at Wrexham Myler Hospital. Tonight at 8:30 p.m, we will be asked to shine a light through our windows to show support for our nurses, our ladies with lamps. I encourage all to do so and show our appreciation on this International Nurses Day. The UK government has confronted this virus as one United Kingdom. Our Prime Minister has set out a roadmap to rebuild the United Kingdom for a world with coronavirus. It is a plan which will give the United Kingdom hope. However, the virus has spread at different rates across the country, and therefore parts of the UK are beginning to move at slightly different speeds. It is this progression of the virus and its consequences that has now caused us, who live on the border with England, some practical challenges. Should they drive the few miles over the border to go to work if work is not possible from home? Should they drive a few miles over the border to drop the children off at school when schools in Wales are closed? Are our neighbours in England aware they can't drive the few miles here to enjoy our countryside for their recreation without risking a fine? This is why a one nation approach to monitoring and managing the R number is vital. I hope the trial of the UK government's contact tracing app is successful, and when available, it is essential that the Welsh Government wastes no time in deploying this app across Wales, the same app as England. To design their own will only cause further delay. However, if this route is taken, then I request that the Welsh app at least communicates with its English counterpart, or else it will not serve us who live in a border constituency, nor will it benefit the national monitoring of this pandemic.